Hey, Public Accord again, coming in with a review that came a bit before the previous June and July recap. We're talking early May. We had this out of the York Daily Record that stands to be readdressed because there's not enough attention on the fact that Governor Wolf and Health Secretary Rachel Levine put COVID positive patients into nursing homes knowingly, along with other Democratic governors like Cuomo in New York. But this comes from the York Daily Record, published May 6th. PA nursing home deaths spike 550% in 1 month as the state faces a federal lawsuit. Now, very interesting stats here that I want to go over, but reading over this, after 1 month of fighting the pandemic in Pennsylvania, Secretary of Health Dr. Rachel Levine said that she was particularly worried about nursing homes. Nursing homes and other long-term care living facilities remain a significant concern to us, she said in early April. This is coming from the person who ordered COVID patients into nursing homes early in the pandemic. What changed? At the time, more than 300 nursing home patients had died, accounting for about half of all deaths in the state in early April. That was already 50% of all deaths were nursing home residents from COVID. Now, at the time, more than 300 nursing home patients had died, so it was only 300 deaths from nursing homes all across the country associated to COVID. But at the same time, that represented in early April half of all deaths. Now, 2 months into the pandemic, being, again, March 6th publication, nursing home deaths have climbed to more than 2,000 and make up nearly 70% of all coronavirus deaths in Pennsylvania. So now we have a vast, disproportionate majority of deaths in PA attributed to coronavirus coming from nursing homes. And that is exactly where Wolf and Levine ordered these COVID positive, quote unquote, non symptomatic or something to that degree patients into nursing homes. But these are the most susceptible people. And now there's a big debate as to whether or not kids are going back to school, or if it's going to be remote, or if it's going to be, half the kids one set of days and half the kids the other. This is madness, people. This is absolute insanity. What are we thinking? Now, imagine this scenario, okay? We send the kids back to school. All the kids go back to school. Everything is fine. We have whatever, plans in place to make sure that they're not exposed overly to, COVID likely scenarios, whatever that means. But all right, now we have kids back in school. They're chilling. They're doing their thing, eating their Lunchables, and a few months in, all of a sudden, oh well, COVID positive kids need to come into your school. Orders from the governor and the health secretary of Pennsylvania. Now, does it make a difference to you? Is it a big deal when it's your kids and not your parents? Like, what line has to be drawn in the sand for people to give a shit that our governor willfully put hundreds of thousands, if not millions, of Pennsylvanian elderly at risk by allowing such absolutely abhorrent behavior in politics to let partisanship dictate, the health and well-being potentially of our citizenship. How do you put people that have no recourse and no way out specifically at highest risk and dump uh, odds against them? It's a tragedy of justice. Now, I want to point out, despite the calls for concern by Health Secretary Levine, deaths in Pennsylvania nursing homes increased 550% in 1 month, from 324 deaths in early April to 2,108 in early May. So there's your 300 to over 2,000. The increases come as nursing homes have less state and federal oversight, as previously reported by the York Daily Record on April 24th. So that's a beautiful link to check into. Just, goes to show that they're making the conditions ripe that these nursing homes don't have oversight and pumping numbers and exposing them to literally positive patients. So state and federal regulators have stopped routine inspections, including in facilities that had been repeatedly cited by the state for failure to protect patients from infectious and communicable diseases. Wow. So a new class action lawsuit seeks to change that. Thank God. And this was months ago. I have not seen any updates yet. I will be updating if I find anything new. Four law firms on the 28th of April filed federal lawsuit in Eastern District Court against PA Department of Health for denying appropriate safeguards and care to nursing home residents. Good. The law firms are Philadelphia-based Schrager and Sachs, Cantor Bernstein Carden PC, Pittsburgh-based Massa Butler and Giglione, and Robert Pierce and Associates and PC. We have a statement from Teresa Blanco, a lawyer with Schrager and Sachs. The State Department of Health has an obligation to inspect and protect nursing home patients, and they are not doing it. And it's that simple. They're actually doing the opposite. They're not only not protecting them, they are putting that population that's already susceptible at significant levels at a much higher risk by putting literal positive patients in their population knowingly. It's disgusting and should be pointed out. So, Nate Wardle, Health Department spokesman, said that the department could not comment on any litigation. No shit. Long-term care facilities have been challenged by the COVID-19 pandemic, he said. We know that congregate care setting facilities face a number of challenges when it comes to the control of infectious diseases. And we're working with these facilities, part of these challenges. Blanco said the department received the lawsuit and has asked for 60 days to respond, and that is 60 days too long. Could not agree with that more either. It is a tone-deaf reaction to a problem that is probably overwhelming, she said. This is Blanco again. In the first 60 days of the pandemic in PA, more than 2,000 nursing home residents have died and more than 10,000 have been infected, according to state data. Nursing home residents make up 22% of all COVID-19 cases in PA and about 70% of the deaths. Now, I mentioned that there were numbers I wanted to talk about. This is the number. This is the absolute point of reference when we're talking facts about what is going on in Pennsylvania with COVID deaths and all of the madness and what's going on with Wolf and Levine. This is a desperate power grab, this new mandate they're riding along on the coattails of other Democratic governors with. They have nothing to defend themselves against literally hundreds, thousands of cases of third-degree murder is what this is. Because they might not have maliciously intended to kill these people, but their negligent actions, regardless of state law, caused the death of these people. If, in fact, they allowed COVID-positive patients to enter this population, which is very reliably proven. So, we see this again. I want to reiterate. While nursing home residents only make up 22% of all COVID-19 cases in Pennsylvania, meaning about 1 in 5 people who get COVID are in a nursing home, 70% of our deaths are attributed to them because they're an at-risk population. And I wouldn't be surprised in the least if this 22% were to go up as a result of putting positive patients in nursing homes. Now, representing clients across the state, the law firm is preparing to file an injunction this week that would force the state to resume inspections, which it should be doing. The lawsuit is not seeking any monetary damages. It is seeking action. The plaintiffs want regular inspections to resume. In accordance with Tom Wolf's disaster emergency declaration on the 6th of March, what is today? Oh my God, July 16th. So 7/16 today. This happened March 6th when he declared the emergency. And just now we're getting mask mandates reinitiated. That's absurd. March, April, May, June, July. 5 months. 5 months. 5 by 3 is 150 days. All right. All of China was done with their lockdown in 73 days. The argument can be made they're an authoritarian state that may have just executed people upon presumption of COVID, exposure, or that there were, fires in their church, or not their churches, fires in their hospitals to, basically eliminate the problem. We don't know. I don't live in China. I'm not going to speculate on that. I have heard as much, but I don't necessarily believe it, because again, we're seeing the same thing here, and we're much closer to this. So why would we concern ourselves with, China and what they're doing to stop the spread, which apparently, even if that were the case and they were executing people outright for having COVID, they stopped the spread and it lasted for 73 days nationwide, that they were locked down and things resumed and it was over. And if you look, there are other countries that are doing this as well. And now, at this point, after 5 months, of this madness since the emergency declaration by Governor Wolf, now we're getting renewed calls to reset, go back to red, put on your masks everywhere or face a fine. It's ridiculous. So, in accordance with the disaster emergency declaration, the Department of Health issued a new set of inspection guidelines. It explained that the state would stop regular inspections in an investigated facility only if a complaint indicated a patient was in immediate jeopardy. Blanco said that she doesn't understand how the state would consider over 2,100 patients dying in over 500 nursing homes from an incurable disease to be in immediate jeopardy. Immediate jeopardy occurs when a nursing home's lack of compliance with one or more state health requirement causes or likely to cause serious harm, injury, or death to a resident. That's the definition. They stated that COVID-19 is not immediate jeopardy, Blanco said. That begs the question, what is? What indeed? I mean, the deliberate funneling of positive patients into this susceptible population sounds like an awful sham and treachery upon the people. And I'm glad that there's a lawsuit against you too. You deserve it. In the absence of inspections, Brighton Rehabilitation and Wellness Center in Beaver County began treating patients with there we go again, hydrochloroquine and zinc in a trial to see if the drug combination would prevent COVID-19 infections, Blanco said. Drug combination has been ended in other studies because of risk to heart health, according to reports. Yeah. And what do we find from CNN reported recently? Oh, lo and behold, hydrochloroquine works. We were wrong. Yeah, you were. Oops. So the failure of the Pennsylvania Department of Health to conduct inspections also resulted in the apparent biomedical experimentation on residents under the guise of clinical trials, according to the federal lawsuit. Think about that. We're talking about Nazi Germany, sick scientists, mad in a basement, like dystopia shit, man. The failure of our health department to conduct inspections has also resulted in the apparent biomedical experimentation on residents under the guise of clinical trials. Federal lawsuit. It is unlikely that such egregious conduct could have occurred had inspections not been halted. This was published months ago, guys. I want to point this out. The state health department is working to ensure proper infection control efforts are being carried out, even without regular routine inspections, Wardle said. But no extra COVID-19 prevention measures have been taken with nursing homes that have a long history of infection control lapses. All PA nursing homes were given the same guidance. Now, infection control surveys will be conducted for facilities and agencies identified by the Center for Disease Control and the U.S. Department of Health and Human Services. But the department is not doing on-site visits at facilities, even if they've had infection control violations in the past. So it's very complicated. If the state continues on-site inspection visits, it risks carrying the virus into a facility that's home to vulnerable residents. It also risks carrying it out. But patient advocates say that now is the time to let nursing homes police themselves, especially with the facility's prior infection control violations. So, when the first coronavirus cases were detected in PA, state officials treated hospitals like the top priority, not nursing home patients. 3 weeks into the coronavirus, when the disease was most affecting Philadelphia and its suburban communities, Wolf said the biggest challenge in PA was the same as in many other states. Yeah, because y'all coordinated to put all the people that were positive in nursing homes. Did you miss that? We have too few facilities to care for the number of critical ill. And if we have a surge in cases, and because this is happening in so many places, we're all competing for the same stockpile of materials. Governor Wolf's words on the 27th of March. On the same day, he knew social distance was working. But social distancing in nursing homes was nearly impossible. Residents live in close contact. Nurses are always checking up on them. As state officials work to deliver millions of protective masks, gowns, ventilators, etc. to PA hospitals, it's not sure how many were given to nursing homes. Mortal said the PA Department of Health's primarily responsible for providing PPE to facilities in need and has pushed PPE out to facilities several times over the last month. Personnel protective equipment has been delivered to all healthcare facilities, including hospitals and long-term care facilities. That includes 4.1 million N95 masks, about 250,000 gowns, almost 1.5 million procedure masks, almost 1 million, 1.5 million gloves, 1.4 technically, but still over 80,000 face shields, over 15,000 bottles of sanitizer, and over 5,500 coveralls. Just given. The department is working to push these pieces of PPE directly to facilities and then also responding to urgent needs via request, Wardle said. Carrie Boyer doesn't remember her dad, Earl Denbo Jr., even having a mask at Brighton Rehab Wellness Center in Beaver County. Denbo on March 28th became one of the first people in nursing homes to test positive for COVID. Every patient on his floor ended up testing positive. Boyer had said himself. Carrie, herself. Denbo, however, was the male patient in the nursing home that tested positive first. Within 5 days of testing positive, Denbo, on April 1st, became one of the first Brighton home nursing residents to die. He was 73. God rest his soul. There were so many cases at the nursing home by April 6th, at least 50, that the nursing home said it was assuming all 450 residents and more than 300 staff may have been positive for the disease. Brighton did not respond to questions about whether masks or protective coverings were issued to patients. While Wolf and governors were talking about protective gear for medical workers, there was no push for masks or covering in nursing homes. In the early days of the virus, federal and state health officials were recommending masks for everyone. They only advised it for people who had the disease. On April 3rd, Wolf had asked all state residents to start wearing masks. Now here we are. Look at this. April 3rd, everybody wear a mask. What is it? July 16th. And we just recently had, restaurants closed, wear your mask, go back to red. States across the country are focused on flattening the curve bullshit, an effort to slow the spread of the disease and reduce the burden on hospitals. It wasn't about flattening the curve, was it, people? It was about getting a vaccine now, or making sure everybody gets the vaccine now. It's always some dumb bullshit extra, and it's been a continual power grab. The fear was hospitals wouldn't be able to handle the surge of coronavirus patients. In New York, some patients died in emergency rooms while waiting on doctors. But with PA's focus on hospitals, nursing home patients were left behind, a lawyer said. Nursing homes have been left to flap in the wind, Blanco said. Nursing home residents can walk into a hospital and ask for help. They cannot, rather. They have to rely on the government to make sure they're getting the help they need at their facility. Right. You're right. They can't just leave. In the absence of regular inspections, no visitors allowed. Nursing home residents are at risk of frequently dying alone. This is so sad, guys. Like our parents, our grandparents. I remember my grandma being in the hospital sick with cancer for months and visiting her, and how tragic and weighty that was as a kid. And I remember the day she died at home in hospice. And I wouldn't wish that on my worst enemy. I wish everyone a long, happy life, surrounded by love and family and friends. And one night you just go in your sleep, and it's a peaceful process. What I saw was a deterioration of, mind, body, and spirit that was aggressive, destructive, and disgusting. And cancer should be destroyed. And I feel like with all the funding that has occurred, it is a tragedy to science and a tragedy to humanity that we haven't come across more leads, at least, than we have. So, here we are with a new epidemic of COVID, and we have, this clear abortion of justice where positive testing patients were put in nursing homes by Levine and Wolf. So unless nursing homes release a statement or patients' families start talking, there's no way to know as to if a resident or employee tests positive for COVID. Great. So now we just have sleepers floating around. After weeks of questioning about nursing home data, the State Department of Health in April started listing nursing home outbreaks by county, but the department is not naming facilities. When asked why, Wardle said, "We're continuing to consider whether to release the names of the facilities with infections, and if we are to do that publicly, it will be shared on our website." And that's a problem, according to Blanco. We don't know what homes they're in. They're reporting various county numbers, but all we have to extrapolate is, uh, that's all we have basically to extrapolate from. So here are coronavirus cases in Pennsylvania. Look at this, totally isolated in Cameron, just 5 cases. Philly, okay, Bucks is at 6,000 something at this point. Philadelphia, 23,000, 1,600 deaths. Right, crazy. Without the state voluntarily sharing what it knows, there's no way currently to get the information from the state government. The disaster declaration puts a hold on right-to-know requests within state agencies that report to him. Oh, how convenient. So Seth Grove is trying to change that. He's got a bill designed to restore transparency. It passed the House unanimously. What do you want to bet? Wolf already vetoed it. Transparency should never be delayed. It should be emphasized during times of emergency disaster, Grove said. Unfortunately, Wolf has taken the opportunity afforded him by COVID crisis to allow state agencies to not answer right-to-know requests by the media and the general public as required by law. That is unacceptable. Agreed. The people and the press have a right to know the government, and equally important, to receive answers to their questions. Wolf opposes the bill, said answering public records requests would be put off throughout the pandemic. As soon as the emergency passes, the process of answering right-to-know requests will resume, said Governor. Some experts estimate the pandemic could last in the U.S. for more than 2 years. Oh, man, what do you want to bet he's a shill? Whatever expert that was, some experts. Yeah, there's more than 1 million cases in the county, or in the country, I'm sorry, and more than 73,000 deaths. But it's just the beginning. That's the CDC director, Tom Frieden. About 80% of COVID deaths across the country are adults 65 and older, according to the CDC. Nobody's response has been perfect, but other states have tried harder to solve the nursing home problem, Blanco said. For example, Rhode Island had the highest mortality rate among nursing home patients in the nation at 71%, just 1% above PA. At this time, the state lists all nursing homes and their corresponding cases. At this time, PA was 68%. It went up to 70, definitely. Maybe even surpassed and became the number one across the nation for a percentage of deaths of COVID attributed to nursing home patients. So, I don't know if I'm going to go through the rest of this. It's kind of like, oh, it's just a couple things. Other states are trying to mitigate nursing home infections as much as they can, but PA's not doing so much. They're just waiting around, and Blanco doesn't know what they're waiting for. Massachusetts acted sooner. They have tons of tests. Great. Look, point, matter, and last thing said is that we knew in May that this is happening. And I'm reiterating it here in July, midway through roughly. May, June, July, 3 months at the end of the month, which I'm sure not many people will see this, but hopefully they do, because, like I said, it's been 2.5 months right now. PA nursing home deaths spiked 550% in 1 month as the state faces federal lawsuit, and nobody's talking about this. Everything's getting censored on Twitter and Facebook. You can't link to QMAP on Twitter anymore. They won't take you there. They won't post your post even. It's just, oh, we had a problem. Oh, I'm sure you did. I'm sure you did. I'm sure you had a problem with all the truth bombs that are coming out about big tech and how you cozy up to pedophiles and all the gross, ugly stuff that Twitter and these big time celebrities and politicians are really into. So I hope that the air is going to be cleared soon. I hope that things get better, and I hope that justice serves over everything. I hope that the people that are responsible for putting elderly population at high risk of contracting a deadly disease, and with hopes what for politicalization, angling this in a partisan way, so that, oh my God, look how many cases, Trump did nothing, blah blah blah. Dude, are you kidding me? There's been no response from Trump that has not been absolutely in accordance with federal law and upstanding citizenship and representation of our country. The disgusting thing is what's traced to you on paper that you're now facing a lawsuit about. So, with that being said, Governor Wolf and Health Secretary Dr. Rachel Levine, I will leave you to consider your free moments before ultimately a very long sentence in jail. Third-degree murder in the thousands, guaranteed. That is a lot of time for both of you. And you know what? If you never get out, that's your fault. How dare you do this to the PA citizenship that entrusted you with representation? You sold their parents out literally down the river for the sake of your own image, and you should be tried. And in my opinion, my understanding of this is that you are 100% guilty of third-degree murder, and there is enough evidence to prove that all day. So enjoy your moments, guys. Tick tock, and where we go one, we go all.